Members, during the 9-month period leading up to the passage of the Patient Protection and Affordable Care Act, Americans were subjected to more than $200 million worth of TV, radio, newsprint, and internet ads. Almost all of these ads, both pro and con, were pure propaganda. Even today, the White House and leaders of both political parties offer us little more than sound bites crafted for the evening news. The government's own website, while containing a lot of valuable information, touts only the benefits of reform and ignores the costs. It focuses on what might go right and ignores what might go wrong. As a result, many people are rightly confused about what to expect and why. So let's focus on the facts. Some of the benefits of this legislation have been in federal law since 1996. But beginning in 2014, for example, a couple with an income of twice the poverty level will be able to buy insurance, no higher than 6.3% of their income. This is great. However, some of the structural features of the reform are exceedingly troubling to individuals, businesses, and individual states, and the costs appear to be just too much to bear for Floridians and Americans. Some of the mandates of this bill include, beginning in 2014, you will be required by law to have health insurance and to attach proof of that insurance to your tax return. Beginning in 2014, if you fail to insure, you will be fined, with the penalty rising to $695 up to $2,085 per family in 2016, or 2.5% of your adjusted gross income, whichever is greater. If your employer fails to offer you health insurance, your employer can be fined as much as $2,000 per employee per year. The type of insurance you must have, including copays, deductibles, and employee share of premium, will all be determined by federal regulations rather than by you and your employer. If you're not covered by an employer plan, Medicare, Medicaid, or other governmental plan, you'll be required to buy insurance in a government-regulated health insurance exchange, where competing insurers will offer government-mandated health insurance packages. And I think as Floridians, we all know what happens to the insurance market when government gets involved in it. I should say as citizens of the state of Florida. From federal control of the delivery of health care to control of marketing to government-subsidized manipulation of health insurance markets, the Affordable Care Act is a baleful prospect for individuals, businesses, and the state of Florida. The Affordable Care Act sets in motion for dynamics that will increase the cost of health care, reduce its flexibility, and ultimately prove a curse to the kind of health care Floridians would like. For all of these reasons, this memorial asks Congress to repeal the Patient Protection and Affordable Care Act, and I urge your support. That is the memorial, Mr. Chairman.